Best question of the week. What do you people have against cows? Well, find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Dr. Liz Cruz, and I've got Tina Nunziato sitting right here by my side. Thank you for joining us for another podcast. If you are a first-time listener, go back and check out our other podcasts. We have a few sitting out there.
Just a few hundred.
So check it out. If you're a regular listener, thank you for being on this journey with us. We love you. We appreciate your loyalty, and we just love that all of you have taken time out of your day to hang out with us for a few minutes. Mm-hmm. So,
what do you people have against cows?
Yes, that's a question that Tina.
Yeah, I got it in one of the consults this week.
Yeah.
And oh my goodness, it was the funniest thing I think I've ever heard. Because I was talking to the patient about cheese, mm-hmm. specifically, and milk. And I was just asking, because I always ask what they eat, during the day on an average day. What do you eat from the time you wake up until the time you go to bed? And she mentioned she had cereal. And I said, okay, do you use cow's milk? And she's like, what do you people have against cows? And I'm like, I don't have anything against cows. I just want to know, are you drinking cow's milk? Or is it almond milk? Because some people do almond milk. Or whatever kind of alternative milk. I just thought it was funny. What do you people have against cows?
It's a great question. It really is. I mean, it definitely led into a lot of good discussion between us. Mm. And I thought it would be a great topic because Tina was actually doing a little bit of research on cows yesterday, as a matter of fact.
Yeah, so one of our twins, Taylor, we were out running errands yesterday, just her and I, and she's like, so mommy, where do you think cow's milk came from? I don't even know why she was thinking this. I don't know where this came from. Maybe she saw a video on YouTube or something. But yeah, she was like, who do you think milked the first cow?
I think that was the question.
Yeah, who do you think
milked the first cow?
And I'm like, I don't know. That's a good question. Let's look it up. So we were doing some research yesterday on the first cow that was ever milked. I mean, it's been like thousands of years, supposedly. Huh. Like the first cows that were ever milked were probably milked by farmers back like 10,000 years ago. Hmm. Like this is before Jesus. Like this is like way, way before Jesus. Yeah. Right? Like, so, and then I guess cheese was actually made first, like 5,000 years ago, and then butter came like 2,500 years ago. So it was like the progression of milk. And then they were talking about how milk changed a lot when it got pasteurized. We learned about the pasteurization of milk and all that. But I just thought it was really interesting. We were reading about why somebody would have milked a cow for the first time. And they were saying that it was probably because the people were starving. Mm. Like they saw the cow there's a farmer, right? They're tending to cows. They see a baby cow sucking from its mother's teat, and they're all starving going, I wonder if I can do that, right? Mm-hmm. So obviously it probably wasn't the farmer's best moment in the world. And you were like, did they actually go down there and drink the cow's milk, or did they know to milk it? I don't know. But anyway, that's how it started. Was probably
that is fascinating.
From the farmers and their families and being very hungry.
But I thought what was actually even more fascinating was the evolution of our body, our DNA, to be able to tolerate the milk.
That's the other thing we learned, is that when people first started drinking cow's milk, we didn't have the enzymes in our body to digest it. Mm-hmm. But over the centuries of us drinking milk, the body formed lactase to digest dairy, which I think is fascinating. However, I will tell you that most people still struggle.
Yeah, absolutely. Well, we see a lot of it.
Yeah.
We see a lot of it, as a gastroenterology practice. I mean, we see a ton of it. Mm-hmm. People come in, they have bloating, they have gas, burping, you name it. They have all sorts of different issues. And, once we do the workup on them then we delve into their diet. And sometimes, a lot of times, just by advising them to stay away from dairy, they get better.
Yeah. Yeah, no matter how much they don't want to admit it.
I know.
And I
know.
will tell you that, like, people eat a lot of dairy
Yeah.
today. I mean, not only just milk, but, we're eating butter and we're eating a lot of cheese. Most people are eating a lot of cheese. And then, also other things like ice cream and cottage cheese and yogurt and cream cheese and all these things are dairy, right?
Sure.
So I will also say that when I do the blood spot test on patients, the food sensitivity test, 9 times out of 10, dairy comes back high.
Wow.
It's really crazy.
9 out of 10?
9 out of 10 patients,
Wow.
dairy will come back high, and we have to have the conversation, about trying to get off of dairy and eating. It's actually not, this is what I tell patients, it's not hard to not eat dairy today. There's so many alternative products that are made today. For this reason exactly, right? Because so many people are lactose intolerant. A lot of people tell me, well, I've switched to Lactaid, which, because they know they're lactose intolerant, so they switch to Lactaid. But I tell them that's still dairy.
And there was a time that you used to drink that.
I did.
Yeah.
I drank it because in my early 20s, I was very lactose intolerant.
Yep.
If I ever had ice cream or milk, and I drank milk all growing up.
So I was going to ask, were you lactose intolerant even as a child?
No, I think what had happened was, my mom was always like a big milk pusher, drink your milk. And I think I just drank so much milk, make my mom proud, I'm going to drink milk, that I just ran out of the enzymes to digest dairy. By the time I hit my early 20s, I would eat a thing of ice cream or drink a thing of milk. I would be doubled over.
Wow.
Pain, bad pain for hours, gas just running through my whole body. And I just realized it's probably the dairy, so I switched to Lactaid. And it did help, but again, it's not fully solving the problem because it is still dairy.
Sure,
right?
sure.
But it's so easy to not eat dairy today.
Yeah,
Because
absolutely.
there's so many alternative milks and there's so many products made from those alternative milks that even butter, you can get butter now made from olive oil. It doesn't even have to be made from cow's milk.
And it's good. I mean, it tastes just like any other butter. Let's talk about some of the alternative milks that are out there, because when we first started on our journey, on our wellness journey, so to speak, we were drinking milk. We were drinking a lot of milk, and
we were drinking 1% milk.
Yeah, 1% milk, but we were drinking cow's milk. And then we transitioned, and slowly we started bringing in almond milk. And I remember we also had some soy milk, and we were just kind of trying out different stuff.
And the main reason why we did that was because of Kai.
Right.
He was, at the time, he's now 16, but at the time he was getting bouts of strep throat over and over again, to the point where by the time he was 2.5, we had his tonsils removed and he still got strep throat.
Yeah.
And then we realized through all the wellness stuff that you and I were doing that it was probably the dairy.
Right.
And we took him off dairy and it stopped.
Yeah.
Literally like that.
It really is amazing. I mean, look, that's why with singers, they always say, if you're going to sing, don't drink milk right before you sing. Well, why is that? Because it produces mucus. Why does it produce mucus? Because it is irritating to the digestive tract. And your digestive tract starts in the mouth. Starts in the mouth, ends in the anus. And then in between there you have the pancreas and the liver and the gallbladder. That's all part of the digestive system. But dairy is definitely irritating. And so your body's reaction to it is making mucus. Okay, now some people may say, oh, well, I don't make mucus, but they may have other symptoms, bloating, feeling gassy, diarrhea. And so we started transitioning. We started experimenting with almond milk, soy milk. Did we try cashew milk? I can't remember if we did. Coconut.
Coconut milk.
Coconut milk.
Yeah.
And
hemp milk.
Hemp
They make
milk.
hemp
That's
milk.
right.
Yeah.
And almond milk won. It actually is the one that I found to be, the one that we just liked a lot.
Yeah.
Okay.
It wasn't as sweet as some of the other ones. And then we were trying to stay off of too much soy.
Exactly.
So we tried to get away from soy milk.
Exactly.
But yeah, it's probably one of the healthier milk alternatives.
Yeah,
that are
almond
out there.
milk. And, and so as far as like other products, cheese products, you can get cheese made from rice.
Rice milk.
Rice milk cheese. And actually the cheese that we get, it's so good. I mean, we make grilled cheese sandwiches. I'm telling you, it tastes no different than an American slice of cheese. It really doesn't. It tastes exactly the same, except that it's actually healthier for you.
Right.
And so we, that's what we've been teaching patients and our customers, that as they come to us, as they're having issues, and Tina does a wellness consults with them. When I get a chance to talk to them at the surgical centers, and we talk a little bit about diet, either before the procedure or after, we talk a lot about dairy, because it's just one of those food groups that is consumed. I mean, such a high consumption of dairy.
Yeah.
I mean, think about it. When I was a kid, there were posters all over our classroom about drinking your milk.
Yeah. And that's what our kids all the time are like, why do the posters say milk is good for you when we don't drink milk at home?
Right.
Right. It's important for them to understand that you have to understand that they're promoting a product, right? And back in the day, it was known that if you drank milk, it would help build your bones, right? Because milk has calcium, bones need calcium, right? The problem is that milk causes so many other damaging things that they're not addressing, right? And I think that, who's promoting drinking milk? The dairy farmers. I mean, of course they're going to promote drinking milk. They're trying to get you to drink milk to make more money. That's the whole
exactly
point.
Right.
So just, be careful with what we're being told out there, the posters we're reading and what we understand about food. Understand where that message is coming from.
Right. And understand that, dairy...
Like the lobbyists, for example.
Oh, sure.
That are in government.
Absolutely.
These are a lot of things you and I learned about
Absolutely.
food when we were
The
doing our
politicalness
research.
of all of this.
Yeah.
A lot of politics.
Yeah.
A lot of politics
Behind
in the food industry.
The meat and dairy industry.
That's right.
Specifically.
But remember, dairy comes from an animal, okay? It comes from a cow. We are not cows, okay?
What?
I know. I just wanted to put that out there.
Thank you for pointing that out. Sometimes I feel like
But you're putting in a product that comes from another animal. It's a little rough for your body to assimilate that and to take it in. So just food for thought. And,
Literally.
Exactly. So, if I were you, I'd get in the car right now and go to Sprouts or Whole Foods and get some almond milk.
That's the other thing. People are always like, oh, it's so expensive, and I'm like, it's no more expensive than a gallon of regular cow's milk. Like, it's not. And the cool thing, like at Sprouts, you can get the little containers of all the different types of alternative milk, so you can try them out. Right? You don't have to buy a huge container of whatever milk to try out all the different milks and see what you like. And then all the alternative products, most of those things are found at Sprouts or Whole Foods.
Right.
I tend to tell people to go to Sprouts because it's a little bit cheaper. But I've noticed even Fry's and Albertsons, they're starting to carry a lot of these alternative products too.
They are.
Because people are asking for them.
They are. And and one more thing I want to say before we bring this to a close is creamers. I get a lot of people that ask me about creamers for their coffee. Guess what? There are creamers out there made from the nuts. Okay, there's almond milk creamer, there's coconut creamer, and these creamers, they're great. They make your coffee creamy, just like Half and Half does.
Yeah.
So just another thing to throw out there as far as a healthier alternative. All right, well, we will bring this to a close. I mean, if you have any questions, look, if you have digestive issues, the best way to connect with us is to get on our website, drlizcruz.com, and right in the middle of the page is a purple magenta colored button that you can click, and you can schedule a free 30-minute wellness consult. Free. All right, that's our gift to you. You do not need to be a patient of ours. This is for anyone. So please get on our website and click that button and schedule your free consultation today. Okay. And also, if you enjoyed this podcast or this episode, please rate us. Okay. Give us a rating and leave us a review, because that'll help other people just like you to find us. And lastly, if you have not subscribed to this podcast, please subscribe. That way you will not miss one episode. Okay? Yep. All right. Well, thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.